Hello everyone, my name is Dr. Ahmed. I've been practicing dentistry for over 30 years now, and I have a special interest in oral hygiene and oral health education. I also like to encourage hygienists, oral health educators and nutritionists to explain fully to patients what the issues are and how to make things better. So education is always the key. If the patients don't know why they're doing what they are asked to do, they're less likely to do it. So here goes. So this is a guide that was produced by Oral-B. There's probably a newer version, but it's the same disease and the same treatment and the same explanations. So let's start by speaking to the patient. I'd like to say, this is what a healthy tooth looks like. And if I can explain that this is the root of the tooth, this is the crown of your tooth, and your tooth is surrounded by gum. So this is the gum surrounding your teeth. This is a cross section. Now, if we look at a healthy gum, it's nice, tight against the neck of the tooth. However, if the gum is slightly inflamed or there's plaque around the tooth, you will find that the swelling or the gum looks bigger than the other side. This swollen gum is not healthy gum. And the dentist usually uses a periodontal probe to check to see how inflamed it is, because it has millimeters markings on the side, or it has some black bands that say how deep the pocket depth is. If we move along, I wanted to explain that plaque is bacteria that is attracted to those gum areas around the necks of the teeth that we were talking about. And plaque is the cause of the inflammation. And if we move along, if plaque is left on the teeth for a very long time and not brushed away, even 2 or 3 days, it will start to harden up and calcify. And this calcified hard plaque is now called calculus or tartar. This is too hard for the patient to clean themselves, so you must see a hygienist when it gets to that stage. And unfortunately, if you leave that tartar or calculus on the teeth, you may see that the gum is starting to recede here. So not only will you get redness, inflammation and bleeding gums, you'll also start to get receding of the gums. So just to recap, a healthy tooth has nice, tight and healthy gum margins around it. A not so healthy gum will be red, swollen, bleed, and especially when you brush your teeth, you might notice that the area is bleeding. This is the time when you actually pay more attention and brush more firmly and more efficiently around the tooth. What happens if you ignore the signs of bleeding gums and continue to avoid going to the dentist or the hygienist to have your teeth cleaned? You'll get something called periodontitis, which is inflammation of the bone and the gum that holds the tooth. If you get inflammation of the bone and the gum this time, the bone will start to recede. So what's happening here is that the plaque that was gathering there has not only caused inflammation and redness and possible a little bit of recession, it's also causing the bone that's holding your tooth in place to recede. And if you allow it to carry on, it'll get worse, and you can see the bone level is now only at about 50% of where it should be. And again, if you allow it to get worse, it will carry on receding, and eventually this tooth will become mobile or maybe move out of place, or you will get an abscess. An abscess is very painful and causes a toothache. And again, eventual tooth loss is likely. So you've got advanced periodontal disease. Now, when you get to this sort of level of disease, It's only manageable or treatable by a specialist periodontist or a dentist with a special interest in periodontology. Here we can manage it with cleaning more efficiently and seeing a hygienist more regular. So what other disease can the plaque cause? So we talked about gum disease, but I want you to make you aware that the plaque, if you don't brush your teeth soon after eating something sweet or carbohydrates, or regularly, usually 3 times a day, the plaque will cause decay. Decay is called dental caries. Another terminology is cavities. Cavities will be produced. So the plaque has to be removed. Unfortunately, when the decay process starts, it's starting on the inside of the tooth, and even if a dentist is looking and searching for something, they may not see it until they take an x-ray and it's visual on the x-ray if it's quite large. So sometimes it can be missed. So it's best always to see a dentist on a more regular basis for this purpose. Leaving it too long, things can get missed. So some of the problems with having lots of plaque in your mouth and the recession is that around the necks of the tooth, the teeth can become very sensitive. So whenever you eat or drink something hot or cold, it can be quite painful or uncomfortable. There are treatments for that. Dentists can put varnishes over the surface of the roots, or you can use certain toothpastes which are designed for sensitive teeth. Stains on the teeth. I'd like to mention that it's just not a colour change in the tooth, but also stains can harbour more bacteria and plaque and encourage the growth around your tooth. So if your teeth are starting to go brown or dark with coffee stains, etc., red wine stains, it's useful for you to go to a hygienist and have that removed as well, along with the plaque and the bacteria and the calculus. We all know that if you don't clean your teeth, you can eventually have bad breath. The plaque is bacteria, and the bacteria growing will accumulate. It doesn't only accumulate on the teeth. Please remember, it does accumulate on the tongue surface, the cheeks as well. So it's useful to have a tongue brush so that you can brush your tongue and just brush the inner surfaces of your cheek as well. And that will keep everything from getting worse. Now, let's talk about hygiene aids and how are you going to avoid getting the gum disease and stopping the periodontitis at home. So I get a question that asks, are electric toothbrushes better than a normal hand toothbrush? Studies show the proof that yes, they are. They're more efficient. So we do advocate in our practice the use of Oral-B electric toothbrushes, not the battery operated, but the rechargeable ones, as the battery ones can become less efficient as the battery runs out, and you won't realise. Whenever you're using electric toothbrush, we always suggest you angle the head down into the gums, as you can see in the pictures. And we always say slight, slow, round movement of your hand, so the head of the toothbrush is also moving around the tooth and allowing it to go over the gum. I'm going to skip the sonic brush. It's very similar to an electric toothbrush. Okay, let's talk about manual brushing. There'll be times when you might not want an electric toothbrush. Manual brushing can be equally efficient as long as you're following the proper routines and procedures. I have a video on this so that I can direct you to that and the correct toothbrushing technique when you're using a hand toothbrush. But just to let you know, again, you're angling the bristles of the brush upwards into the gum when you're doing the top teeth and downwards into the bottom gums. It's almost like a 45-degree angle. And again, you're scrubbing the teeth with moderate pressure, not soft and not too hard, in a circular fashion. allowing yourself to go on the tooth and the gum to an extent. Now I'm going to say the next important thing that you need to do is remember that bacteria also harbors in between the teeth, and a lot of disease, especially decay, starts between the teeth, and gum disease starts between the teeth. So it's really important you learn to clean your teeth between. There's several ways of doing this. I'll mention a few. One is flossing. So with floss, when you hold it, you must hold it nice and tight. There are some aids that can be used, like sticks with the floss across it, and I'll show you them later. The floss passes down between the two teeth. You must allow it to go down the gum on one side, come back up and go down the gum on the other side. And this you do 3 or 4 times on both sides, aiming to loosen up anything that's on the tooth and between the tooth and the gum here. This will help dislodge the plaque and bacteria and prevent growth. Here's a more here's more pictures that show the process, where again you're going up the side of the tooth. You're not just going up and down between the teeth, otherwise that will not be beneficial for you. It's going up and down the side of the gum where the plaque harbors. You've also got TP brushes. They look like little baby bottle brushes. Dentists or hygienists should measure these because they come in different sizes and instruct you on the proper use in your mouth. And again, as you push them in and out between your teeth, especially where you've got bigger gaps where floss will be less efficient, you need to use the TP brushes. TP brushes, again, you feed it through, and remember, you're very gently wiggling it up against one side of the tooth and then the other side of the tooth. There's a natural gap between the gum and the tooth. You're not causing it. You're just cleaning in that natural gap which harbors the bacteria. So what do you do if you have implants, bridges, crowns, or even braces, wires, or bonded retainers? You can use something called super floss. It's a floss and it has a stick-like element to the ends of it, which you can feed through and then clean the gums as shown on previous pages. And again, you allow, especially for implants, the implant is actually right in the center of your tooth. You allow the floss to go right up to the implant and clean all the areas underneath. Into dental picks, I prefer the wisdom stick. Wisdom sticks come in blue and green, blue being finer and green being slightly bigger. These are very handy too. So if your gap is too tight for TP brushes and you can't master your floss technique, or you're always in a rush, you can use wisdom sticks. And again, they're used in the same way and you might find them easier. And you should ask your hygienist or your dentist to show you the use of these. The other way to clean in between teeth, which is shown to be quite efficient, but I like to think that you will mix and match your interdental cleaning with oral irrigation. I would never do oral irrigation on its own. So there's something called a water pick. The water pick is a very handy unit which has water in there. You can put your own special mouthwash rinse in there as well. Use warm water and it shoots between the teeth, dislodging some of the plaque and bacteria. Hopefully that's a lovely guide to healthy gums, but what I've done is I've left the best for last. I'm going to show you a video or the actual TP brush, which is highly efficient in maintaining healthy gums and getting to that stage. And this is the secret. You have cleaned and brushed your teeth. You have cleaned in between the teeth. But what about cleaning that gum line really efficiently, and not just with your toothbrush? especially if you have crooked teeth or are going through Invisalign or braces and wire orthodontic treatment. You can use something called an interspace toothbrush, which has single tuft on it, and sometimes it's called a single tufted toothbrush. That's a video I can show you, or again, you should ask your dentist or your hygienist to show you how to use that. So remember, you have your electric toothbrush, you have your interdental cleaning methods, you have your tongue brush, and you have the secret, the gum brush called the TP Interspace. Thank you for listening.